I'm telling you, this is the most reliable thing I've found clinically. Okay, obviously MRI with contrast is very reliable, but clinically speaking, this is the most reliable way that I diagnose slap tears. Most people have crappy posture. If you look at them, most people, the shoulders are forward like this, right? And they have crappy posture. But what that does, if you look at the kinematics, is that it goes like that and it jams it, right? So I tell these people that posture is not an option for you. You need perfect posture. In this particular guy's case that I evaluated today that had AC joint arthritis, he said, it just hurts when I weight lift. And I said, what, bench press and overhead? He's like, yeah. And I'm like, well, stop doing that. I'm like, are you in the CrossFit Olympics? You know? And he's like, no. And I'm like, you're 32-year-old dad with a kid. And I'm like, why are you doing that? And he's like, I said, it's just wearing down your AC joint. Hey everybody, what's up? Physical therapist, Dr. Ryan Whelton, coming to you from just outside the beautiful Tampa Bay that I go into a couple times a week. So today we are talking about the AC joint. Now, the AC joint is a little bit tricky in the sense that, so we as rehab people, physical therapists, whatever, chiropractors, whatever, we rely on muscles that cross joints, you know? So like if something's out of alignment, your SI joint, you know, you can stretch certain muscles, you know, strengthen certain muscles, glute med, adductors, boom, you realign it, right? When it comes to the AC joint, okay, which is what people talk about in football when someone separates their shoulder. When it comes to the AC joint, they tear a ligament. So they tear ligaments. They tear the coraconavicular ligament and the acromioclavicular ligament, okay? Ligaments. And what happens is they can get what we call a step deformity, right? So you have this is my shoulder blade right here. My clavicle comes and attaches right here. And what happens is that that attaches up here, couldn't see. And and when you tear the ligament, then you get what's called a step deformity. You see those people with, you know, one bone jetting up like that. And when that happens, they can get pain in their shoulder. Now, in my case, I don't really have a step deformity, but when I was in when I was 20, early 20s, I went to the orthopedic because I had posterior labral tears in my shoulder from a strength coach that made us do a college strength coach that made us do 105% of our max and bench twice a week. And I was doing so much weight that it actually ripped the humeral head, ripped the posterior labrum, which is not common, but you start putting that kind of force through it, then you do it, right? Anyways, the guy actually pushed on my AC joint and said, does this hurt? And I said, no. And he said, man, those are really arthritic in my 20s, right? And the reason why is because I was doing so much bench press and overhead stuff that I was just grinding that joint and wearing it down, okay? Now, I don't have a step deformity, but off and on, I will get AC joint pain, you know, hurts to lay on their side, you know, come across their chest, adduct like that, and you feel it right there. The question is what do we do about this, right? So when it comes to the AC joint, today I had a patient came in and he said, I've had this shoulder pain. I can't lift weights. I've been lifting since I was a teenager. He's in his 30s, early 30s. He's like, I can't lift weights. So I ruled out, you know, with the O'Brien's test, I ruled out a slap tear and made sure that it was coming from up here, not from here. And then, you know, ruled out bicipital tendonitis. I go over that in another video you can see on my YouTube or Spotify or Apple Podcast. And I ruled out that it wasn't bicipital tendonitis. I don't like the speeds test. I talk about it in that video. You're better off just touching the long head of the bicep tendon. and then ruling out a slap tear and making sure that it's not deep. The person knows. If you ask them, look them in the eyes, they will know. I talk about it in that other video. They will know if it's deep in the joint or whether it's superficial tendon, okay? But the AC joint, as a differential diagnosis, can also radiate pain down into here. So you have to be careful that you don't diagnose them with a slap tear or with a bicipital tendonitis when it's actually AC up here, because that can go like this, okay? Pain all in here, all in there. Right, so this guy had pain in here, so I needed to make sure that my diagnosis was correct. So I did, the O'Brien's test, and I, held him right here. It hurt. Turned his hand over. It didn't hurt at all. But if it did, they say to a lesser extent, when you turn the hand over, it could indicate a slap tear. But my criteria for a slap tear, and I found that my patients are always right, is that you look them right in the eyes, and I'm looking for their level of certainty. And I say, is this deep in the joint when I do this, or is this superficial, like a muscle? And the patient always knows. If you follow it up with a MRI with contrast to the shoulder, you'll find that they were right. I'm telling you, this is the most reliable thing I've found clinically. Okay, obviously MRI with contrast is very reliable, but clinically speaking, this is the most reliable way that I diagnose slap tears. This is the patient always knows. So anyways, so I make sure that in this case that the guy didn't have a slap tear, and he didn't. And then I started pushing around in here, and I'm like, he goes, no, it's more up here, right? And I'm like, okay. And then he starts going like this. Look, when I go like this, clunk, clunk, and I made sure that it wasn't his shoulder clunking, his glenohumeral joint, right? So I made sure that it wasn't this clunking in there and that he had instability. I made sure that the clunking was happening up here. And I put my hand right over his AC, and when I did that, you could feel it just going like that, right? And, he said, so I said, you have AC joint arthritis. I said, welcome to the club. I had it, in my 20s. And I said, and if you talk to orthopedic surgeons, they'll tell you some of the worst shoulders they've ever been in are weightlifters. And I said, you are doing bench press, I assume? Yeah, I've been doing it for 20 years. And I'm like, yeah, me too. And I had, significant arthritis that the orthopedic surgeon was shocked that I didn't have pain in it in my 20s. And then so when it comes to these patients, I make sure that I diagnose that it was an AC joint issue. Then what I do to confirm it is I use my methods, like my myofascial referral technique, my instant pain relief method that I developed that you can download right now, the introductory shoulder course, and try this right now. And it's money back guarantee. And I stimulated a different area of his body. And when I did, boom, his pain was gone in his AC joint. So I can target the AC joint. I use that as a diagnostic method. And boom, his AC joint was gone when I targeted it. And boom, his pain was gone. Immediately, full range of motion, immediate pain relief. But the question is how do you make that stay away, right? So this person has AC joint arthritis, right? So what can you do about it? So what I do about it is, I cover this in my Rehab Results online course. The protocols course, my orthopedic protocols, is you have the clavicle coming in and articulating here. And what happens is they wear it down, they get arthritis, or they get a step deformity, right? Well, most people have crappy posture. If you look at them, most people, the shoulders are forward like this, right? And they have crappy posture. But what that does, if you look at the kinematics, is that it goes like that and it jams it, right? So I tell these people that posture is not an option for you. You need perfect posture, like shoulders back and down for the rest of your life, because you need to open that up, okay? Then we strengthen the parascapula, stretch the chest, as well as some other things, and that usually gives them some relief, okay? Usually significant relief, I would say, for the arthritis part of it, and even a step deformity. But when people have a step deformity, I found if it's a chronic thing, I believe there are braces, but one of the things you can do is leukotape it. So there's a technique where you leukotape it, put cover roll on and an X, right? And then you tape it down. And that usually provides immediate relief. So anyways, that doesn't usually bother people so much, just weightlifting. And in this particular guy's case that I evaluated today that had AC joint arthritis, he said, it just hurts when I weightlift. And I said, what, bench press and overhead? He's like, yeah. And I'm like, well, stop doing that. I'm like, are you in the CrossFit Olympics? You know? And he's like, no. And I'm like, you're 32-year-old dad with a kid. And I'm like, why are you doing that? And he's like, I said, it's just wearing down your AC joint. And he said, I don't know. I didn't know any better, you know? And I said, yeah, no, I don't do that. You know, I do flies and I stop right here. And I don't go here because I don't want to jam my AC joints because I already have arthritis. And I do lateral raises with weights, but I don't go past 90 degrees because now I'm shearing my AC joints. And why would I want to do that, right? And so I don't do overhead press personally, you know, and I recommend my patients don't do it either unless you're a young athlete trying to get somewhere in life, right? But when you're older, like me, with kids, like I'm just a dad, like what do I need to do that for and then wreck my body, you know? When you can do it a different way and not cause arthritic changes to your body by just shearing bone on bone, right? Why would anybody need to do that, right? So that's how I think about it. Is I don't like, you know, I mean, the human body can do extraordinary things, but we don't have a cure for this right now. In our society, we can't just regrow, you know, the cartilage and the the AC joint and lock it down. So why would I shear it? You know, now if there was some kind of machine that would just magically cure it, maybe I'd think about doing kind of that other kind of stuff, but not so much right now. So so that is how I deal with in rehab AC joint issues. Now, one of the issues in diagnostics with the AC joint is, one of the common things is you can ask them is, does it hurt to lay on your side at night, right? Because if you think about it, they're just shearing their AC joint, right? Does it hurt to lay on your side at night, right? And they'll say, yeah, usually. That's usually the main complaint, right? And then you can take their arm and bring it across their chest like that, and now you're shearing the AC joint. But make sure you palpate it, because it hurts to touch. So I made sure with this patient I evaluated today, I made sure that when I pushed down on that AC joint, that this guy said that hurt right there. Not down in here where the slap tear would be, or bicipital tendonitis, way up here, okay? And he even had the clunking to prove to me that it was AC joint, okay? Because that can be a little tricky triangle, if you will. You know, you got AC joint, you got bicipital tendonitis, and you got a slap tear. All of them hurt in this region. So you have to be accurate with that diagnosis. And with the AC joint, with AC joint arthritis, it hurts here, can radiate down, but it usually hurts right over there, you know, if you touch it, usually. But they'll say that it hurts to lay on their side at night. And it hurts to go like this, you know, adduction across their chest. So anyways, that can be a little tricky of a diagnosis, but you got to rule out slap tears. And I'm telling you, the most accurate way is to look them right in the eyes and ask them, is this deep inside your joint, or is this more superficial like a tendon? The patient knows. I'm telling you, they know. Just like someone that dislocates their shoulder. Like people say, I think my shoulder is dislocated. And I say, you would know, you would tell me my shoulder is dislocated, not I think it's dislocated, right? You know, like when you dislocate a joint, like even if you've never done it before, you know it, you know, like you know, my shoulder is out of the socket right now. I've never done it before, but 100% this is out, right? You know, and it's a lot like that I found with slap tears, is that the patient knows. So, but remember to look them right in the eyes, and concentrate on how sure they are. Because if they're wishy-washy about it, I'm wishy-washy about it. If they're sure of it, which they almost always are, yes or no, then I'm sure of it. And even with slap tears, I can go into the back and here, you know, I can feel it right through the joint. Okay, so anyways, that's AC joint, and that's a differential that you can do, differential diagnosis you can do for AC joint, bicipital tendonitis, and slat tears. So anyways, that's that. If you want to take my courses on this, all of my courses are on. Patients drop F-bombs in the clinic because they can't believe that their pain is gone by stimulating a different area of the body. I map the body, 1,000 pages of maps of the body, and I show you exactly how to stimulate it. So these points move with the myofascial system. They move. So if my thumb is facing up and I'm pushing down on my brachioradialis, straight down, connecting to my bicipital bicep, long head of my bicep tendon, that connects there. But if I turn my thumb 5 degrees, then it's not connecting here anymore. Now it's connecting over to my supraspinatus. But if I turn it out 5 degrees, then now it connects to my, let's say, short head of the bicep tendon, right? Now, if I go like that and stretch the fascia, now it connects down into here in the belly of the bicep. But if I go like that, now I'm way up in the AC joint. But you don't need to know that because I mapped it and I show you right there on the maps. Position the patient. With me, it's very practical. Immediately or almost immediately, that it works. You know what I'm saying? It's not this theoretical thing. Because if you're going to be this person that jumps from research to research to research your whole career, this is not my opinion. This is a historical fact that you will be wrong most of your career. And my examples include their quote unquote therapeutic ultrasound, which I stopped doing. I never did, even when they tried to force me to do it. The doctors, I would sit there and I'm like, nobody feels any better at the end of this. What am I doing here? You're telling me it's helping them? I don't know. I don't think so. They don't think so. The patient doesn't think so. So what am I doing? This is a waste of time. Phonophoresis, right? I'm like, this is also a waste of time. Nobody feels better after I do this compared to the myofascial method or these magnetic field therapy stuff that I'm doing. You feel better. It's wow, look at that. That's what I'm looking for. Other examples, traction helps in the short term, not in the long term. Core stabilization, same thing. SI joint doesn't move. All the science was there. All the science was there to prove that this was true, only to be unproven. And that it wasn't true, So if you're going to be that person that jumps from research paper to research paper to research paper and go with the trends and the fads and the profession and whoever's talking, you will be wrong statistically most of your career. Okay, but one of the reasons why I publish these. Peace. Love you all.